For this lab, you'll be working on the isolated hind end, and this is a calf. And so your calf should have been taken apart. You should have taken the head off and stored that separately, and then cut the hind end off, so you've isolated that and made a lumbar cut and discarded the thorax part of your specimen. So now you should just have your hind end left and then your head separated and stored for later. So on today's lab, we're working on the internal pelvis and the perineum area. So we're going to just start laterally so I can show you where we're at, and then I'm going to turn the specimen over so that you can see inside the pelvis. So again, this is the calf, and on the calf you're going to have a lot more fascia and a lot more fat that you're going to have to deal with while you do this dissection. So to start out with, we're going to look at the abdominal wall layers, just so you can reorient yourself to where we are. So here we would be the most lateral aspect, and this would be the external abdominal oblique aponeurosis. Then the next layer would be the internal abdominal oblique muscle. Then here we have a little bit of the transversus abdominis muscle and its aponeurosis as well. Then we have the rectus abdominis muscle. So these are on both sides. I was just showing you one side, but they're also over here on the right side. So when you're doing this, you want to be careful to not tear everything apart, but you do need to remove some of the fascia to be able to see the structures for today. So on the internal pelvis, you're going to start out by looking for the ductus deferens if you have a male. Otherwise, you're just looking at this inguinal vaginal region here. So the vaginal ring would be this area here. And it's torn apart. It won't look like that until you start dissecting, because I've torn a lot of the peritoneum away. But the vaginal ring is going to be in this location here. And we're looking at where the rectus abdominis comes in. So you have both of your rectus abdominis. And here's the bladder. I'm pointing to the bladder with the probe there. So just elevate that out of the way so that we can see this prepubic tendon. So those rectus abdominis muscles are coming in and inserting here on this prepubic tendon. So you want to make sure to see that. And that's kind of in between your two vaginal rings, left and right. So your vaginal ring would be here, prepubic tendon is here, vaginal ring over here. All right, so once you find your vaginal ring area, if you have a male, again, you're going to look for the ductus deferens that's going to be traveling through that vaginal ring. So here we would have a ductus deferens, and these calves are not very mature, so they don't have a lot to them, but you can at least see where the ductus deferens is running, right here. And alongside that, you have a very small testicular artery and vein. So here, running right along that, is the testicular artery and vein. You can actually see in this specimen the testicular artery is coming right off of the aorta here. It's very small. And those together then are going to run through the vaginal ring and through that deep inguinal ring, through the inguinal canal, and that's going to be your spermatic cord. So the ductus deferens, testicular artery and vein together are going to run through the inguinal canal and then come out superficially. So we're going to look at that. So here we're going to just go through the layers and move out to the internal abdominal oblique muscle. So here is where you get that cremaster muscle coming off the caudal edge of internal abdominal oblique. So that's the muscle you're seeing coming off of the caudal edge here. So cremaster muscle is then running alongside what would be your spermatic cord in the male, right here. So that's that ductus deferens and testicular artery and vein. And this also would be where you would have them coming out of the deep inguinal ring. So that would be the structure they're passing through right here. And then they're traveling through that inguinal canal, through the aponeurosis of external abdominal oblique, and then they would come out of the superficial inguinal ring, which in this one is down here, but I made an artificial hole so that we could see that structure coming through. So we have your spermatic cord with the cremaster muscle on it coming through, and that's coming down to the testis right here. And that superficial inguinal ring would be this opening, this slit in the aponeurosis where those are coming out. So the only other thing I want to point out here before we move back inside the pelvis would be that that cremaster muscle that you're seeing there, so that cremaster muscle is attaching to the vaginal tunic and the internal spermatic fascia. So that's the coating you're seeing here. So the internal spermatic fascia would be here, and your vaginal tunic then is the next layer down. So that would be parietal vaginal tunic. Then you have visceral vaginal tunic if you would actually open that up, and the visceral vaginal tunic is coating the things inside. So it would be coating the testis and the ductus deferens, etc. All right, now we'll move back into the pelvis, and we're going to look at some of these vessels in the internal pelvis. So I'm going to try and tilt it a little bit so you can get a better view. So we're going to start with the aorta, and you're going to trace your aorta down to its terminal branches. So the terminal branches in the bovine here are going to be the external iliac, and you have a left and right, so this would be the left external iliac. Here would be the right external iliac. Then we have internal iliacs, so a left and right internal iliac, here and there, and we'll follow those in another lab. But then you also have this median sacral artery in the bovine that we didn't see in the pony. So you just don't want to get confused by that extra little vessel there. So today we're going to follow the external iliacs. So here we have external iliac, external iliac. We're going to trace those out and find their branches. So the external iliac will give off this deep circumflex iliac right here. Then you'll continue to follow external iliac and find where the deep femoral artery is coming off. So deep femoral is here. And then similar to what we saw in the dog, we have that pudendo-epigastric trunk come off of deep femoral, so that's right here. Then your pudendo-epigastric trunk is going to give off two branches. You have the external pudendal, so that's the one that dives down and goes through that inguinal canal alongside your spermatic cord here in the male. Then you also have the caudal epigastric artery. So that's right here, and I'm just going to reflect this transversus abdominis. And you can see that caudal epigastric is running into my rectus abdominis muscle. So it goes into the deep face of rectus abdominis. So that's caudal epigastric artery. And your external pudendal artery is the one going through the inguinal canal. And those both come off of your pudendo-epigastric trunk that comes off of deep femoral, coming from external iliac. Now the external iliac also has a large continuation that's going to go out into the limb. On the left side we've removed the limb so we can't actually see that, but we'll go over these arteries on the right side and hopefully be able to see that coming out into the limb where it becomes the femoral artery. So on the right side of this animal we have external iliac, again here. You have your deep circumflex iliac coming off of external iliac continuing. Then we have the deep femoral coming off. So deep femoral artery here. That will in turn then give off a pudendo-epigastric trunk. And then your pudendo-epigastric trunk will have two branches. One is the external pudendal going through the vaginal ring and inguinal canal. The other is the caudal epigastric artery that will go along into your rectus abdominis. Then if you follow the continuation of external iliac, it's going to go through the vascular lacuna and out into the limb. So we're going to try and see that. So here you would have the femoral artery, so that's the continuation of the external iliac once it comes out of the vascular lacuna and comes out into the hind limb. That would be femoral artery. All right, now we're going to move on and look at the perineum. So now we'll look at the perineum, and the perineum is this whole region here. And that extends from the tail, so the tail would be right here, so extending from the base of the tail all the way down, in this case, to the scrotum since it's a male. So this whole area is the perineum, and it goes in between the tuber ischiae, or ischiatic tuberosities. These are also called the pin bones in cattle. And so you can't see them because they have a lot of muscle still covering them, but it's not necessary to actually see the bone as long as you can feel them and palpate where they are. So between those is the ischial arch. So between your tuber ischiae would be the bony arch, that is the ischial arch, and that's all covered with muscle right now. But this whole region is the perineal region, And you want to note just a few things in this region. So you want to be very careful when you're skinning because everything is very superficial and the skin is very thin. So you want to skin right around the anus and you want to look for the external anal sphincter. So that's this muscle that's just going around the anus. And it's not as differentiated or as clear as it is in the pony. So it's a little bit less striated and less distinct. So it's less distinct in the calf here. But you can see some of the muscle going in that circular fashion around the anus. Then you also want to look at the muscles that make up the pelvic diaphragm. And we'll look at this on both sides here because you'll have both left and right sides. And so the pelvic diaphragm is going to be the levator ani muscle. So here is the levator ani, and that's going toward the anus and kind of runs underneath this external anal sphincter. So levator ani. Then you also have the coccygeus muscle, and that's going to extend up to the tail. So coccygeus and levator ani on this side, and those make up the pelvic diaphragm. Then you also, while you're in this area, want to look for the retractor penis muscle in the male or retractor clitoris in the female, but here we have a male, so this would be retractor penis, and it's going to be this little slip of almost nerve-looking tissue because it's white and it's a smooth muscle, so it looks very different from other striated muscles. So here it's kind of this whitish muscle right there. It's a little sliver, and it's going to go run underneath your levator ani, and then it will continue on down here around, and then they actually meet, so both sides will meet then on the midline of the penis. So this is your retractor penis muscle here. So on the other side, I'll just turn it over so we can see that this also happens on the other side as well. So here we have that external anal sphincter. Then we have our pelvic diaphragm made up of the levator ani, right here, and your coccygeus muscle going up to the tail. So coccygeus, levator ani, those make up pelvic diaphragm, external anal sphincter, and then we also want to look for that little slip of smooth muscle that is the retractor penis. So you have retractor penis here, re-emerging here, and then coming down to go to the midline here and meet up with the other side. Now in these calves they've had surgeries, so they were repurposed animals from a surgery lab, and so this area is probably not going to be very helpful because the penis usually is cut at least somewhat in this area from prior surgeries. So hopefully you can at least get the base here and get your retractor penis muscle on either side and see where they kind of come together. The other one we want to note here is another smooth muscle, and that's extending from the rectum to the base of the tail, and that is called the rectococcygeus muscle. So if I can get my probe under it. Again, this muscle is not as distinct as it is in the pony, so here in the calf it's a little harder to see. But here I have the probe underneath that muscle, and you can see it's extending from the rectum here up to the tail. And so it's just that smooth muscle that's called rectococcygeus. Now that external pudendal artery is going to run through the inguinal canal and emerge alongside your spermatic cord from this superficial inguinal ring. And so your external pudendal artery, it's a little bit difficult to see, but I'm going to elevate it here with the probe, is coming out right here. So external pudendal artery emerges out of that superficial inguinal ring, and then it's going to branch into two branches, similar to what we saw in the dog. And so you have a ventral scrotal here going caudally, and then you have the caudal superficial epigastric artery going cranially. So here again, you have external pudendal artery coming out of that superficial inguinal ring and branching, similar to what it did in the dog, into those two branches. So you have a ventral scrotal that's going caudally, and then the caudal superficial epigastric artery going cranially.